Namaste. Research on yoga therapy for cancer conducted in collaboration of SVYASA with MD Anderson Center for MD Anderson Cancer Center, Houston, USA. The Department of Integrative Medicine in the MDACC of Houston, headed by Dr. Lorenzo Cohen, took interest in this area of trying to study the effect of mind management in patients with breast cancer, and he selected to collaborate with SVYASA to incorporate the integrated approach of yoga therapy, which has got a very sound, strong, scriptural, philosophical and experiential basis. And this was a randomized controlled trial on breast cancer patients of stage 2 and 3, where there were 3 arms. One group did the integrated approach of yoga therapy, which included some physical stretches, breathing practices and meditative practices, and one group did only stretches, and the third group was the waitless control with the conventional management. And these were the patients who were undergoing radiation therapy for breast cancer, and during that period of about 5 to 6 weeks when they were undergoing radiation therapy, they were made to do these practices, and the results were very interesting. One of the fascinating results that really created a big impression was that people who did yoga were sleeping better. It was the simple but very, very powerful message that was brought out in this study. Then their quality of life as measured by SF-36 was also much better in both the yoga and stretch group as compared to the weightless control. Then benefit finding was also very good in the yoga and stretch groups. We measured the cortisol slope, which indicates the stress levels in these people. Just like we saw in the advanced metastatic breast cancer patients, these patients also, we were measuring the cortisol level both morning and evening. And normally, normal people, the first morning sample of salivary cortisol will be high, and as the evening comes up, the salivary level decreases. There is a slope, and if there is a stress level, the slope will go away and it becomes flattened. What we observed in this study was the slope was steeper in the yoga group as compared to the non-yoga group, where the cortisol level remained a little high by evening, indicating that their stress levels were much higher. And this has long-term consequences for recurrence too, and for survivor management too. So these are some of the studies. Based on this, we now have an ongoing project of 5 years, which is funded by the National Institute of Health, NIH in USA.